Welcome everybody to today's webinar entitled Reporting on Child Deprivation and Opportunity in Australia. This is a special webinar as today it features work done by ARACY in the form of a new report on deprivation. It also features ARACY analyst and lead author of the report, Kate Solis. Kate joined ARACY in 2017 as a Senior Policy and Research Officer. She has a professional and academic background in statistics and has worked at the Australian Bureau of Statistics for a number of years. She has a research interest in impact evaluation and is currently undertaking a PhD at the ANU Centre for Social Research and Methods. Besides producing the report we'll talk about today, Kate was also lead author on ARACY's 2018 ARACY report card on the wellbeing of young Australians, which, like this report, has attracted a lot of attention from the media and from policymakers. So without further ado, I'll hand over to Kate.
Thanks, Paul. And before I get started on the presentation, I'd firstly like to acknowledge that this webinar is reaching across the more than 500 Aboriginal and Torres Strait Islander nations that make up contemporary Australia. So we'd therefore like to acknowledge the traditional owners of all these countries and pay respects to their elders, past, present and future. So as mentioned by Paul, I'm here today to give an overview of the findings from the ARACY report that was released over the weekend, entitled To Have and Have Not. But before going any further, I'd like to recognise the many individuals and organisations who provided us a lot of support in putting this report together. So that was from both a technical data perspective and also from a policy perspective. In particular, I would like to acknowledge our partner UNICEF Australia and Alison Elliott from there, who provided considerable input into the paper, and also the Australian Government Department of Social Services, who funded this project and also provided advice throughout. So to give an outline of what I'll be talking through today. So firstly, I'd just like to give a sneak preview of the findings. So this is a last slide, first slide kind of method. Secondly, what we did, so what we actually did to produce this measure of deprivation and the methodology involved. Thirdly, why we did it. So what was the purpose behind doing all this work and producing this analysis in such a way? And then going to, I suppose, what's the most interesting part is the key findings. So I'll talk about the findings at a national level. So we looked at all Australian children, and then we also looked at three particular population groups who are known to live in more difficult life circumstances. So that's children with disability, children in monetary poverty, and also children living in jobless families. I'll then put forward some policy recommendations that we think will help to address the issues identified in the report. And finally, we'll go to a Q&A session. So firstly, a sneak preview of the findings. So our report found that at a national level, children are generally doing pretty well. So around 1/4 of children can be said to have high well-being in all nest areas. And I'll talk a bit more about how that's measured in a few slides. However, the report also identified that there are some issues. And these include bullying. So bullying is as high as 26%, with children experiencing frequent bullying and social exclusion. Financial insecurity, around 1/5 of children are living in financially insecure homes. And nutrition, so up to 26% of children are not getting any fruit or vegetables. And finally, some Australian children are doing it tougher than others. So in particular, we looked at children with disability, and we found that they tend to be socially excluded in the community and the school environment. However, they tend to be doing pretty well at home, where parents have more control over their situation. Children in monetary poverty, where we found that the deprivation experienced by these children spreads much wider than just their material basics. And finally, children in jobless families. And we found that even when controlling for their lower income levels, children in jobless families are experiencing greater deprivation than can just be explained by their income. So now to go on to the methodology, and I will talk about this for some time because I think it's important to get a full grasp of what we did and how we measured deprivation. So firstly, I'd like to introduce ARACY's NEST framework, which I'm sure many of you are already familiar with. However, I'll give a quick recap. So ARACY's NEST framework stipulates that all young people should be loved and safe. They should have material basics. They should be healthy, learning, participating, and also have a positive sense of identity and culture. So this work was based off consultations ARACY did back in 2012, and it included around 3,700 children and young people. So these dimensions, as we call them, come from the voice of children themselves, and there are things that children have said, we need this to live a good life. As is sort of represented, not entirely, but somewhat through this, the figure on your screen, is that they all do overlap, and they all overlap with each other, and they're all intersected. And so while we talk about them as 6 discrete dimensions, there's a lot of overlap and relationships between all the dimensions. So essentially what we did is we took the ARACY NEST framework and we overlaid it onto the UNICEF MODA methodology. So MODA stands for the Multiple Overlapping Deprivation Analysis Approach, and it's a way of measuring and constructing an easy to understand index that, that reflects and represents child deprivation. I won't talk about MODA in too much detail. However, the steps that we took to put this report together, which is described in the subsequent slides, take you through each step that MODA involves. However, it's worth highlighting four key things that MODA think is important and that MODA really highlights. And that's firstly that the child is seen as the unit of analysis. So a lot of research and studies on child deprivation and child poverty often look to the circumstance of the child's family and use that as a proxy for how the child is doing. However, the UNICEF MODA methodology encourages, wherever possible, seeing the child as the unit of interest. Secondly, it emphasises that the needs of children change over the life course. So if you're selecting indicators to reflect child deprivation, they need to change as children get older because their needs change. Thirdly, it highlights the importance in assessing the way deprivations overlap. And so as I've just mentioned with the NEST, how we emphasise how they're not 6 concrete dimensions, they all relate with one another. So the MODA methodology really encourages looking at the way these different deprivations overlap and highlighting that. And finally, it encourages concentrating analysis on highly deprived groups, which we have done in this analysis. So the reason we chose the UNICEF MODA methodology was that these four reasons, they really align very well with the NEST and how we talk about the NEST. So then once having sort of our framework of the NEST and then our methodology, we then had to determine components of a deprivation index. So I'll talk a little bit about this slide. So in order to holistically examine all areas of a child's well-being, we needed to operationalise, in a way, the areas of the NEST. So how can we measure loved and safe? How can we measure material basics? And this can be quite difficult because obviously a lot of things fall into those dimensions. So we went back to the NEST consultation document back in 2012 and we looked at, okay, what were the main themes? What were the main things that children brought up over in 2012? And so we selected basically 4 measures under each of the NEST dimensions. So for example, loved and safe, we have relationship with friends, relationship with family, safe at home and safe at school. So we definitely, in producing this sort of framework, we're not saying that these are the only 4 things that are important or relevant to loved and safe, but at a very high level, when you're looking at the whole population of Australian children and you're trying to measure their wellbeing using a simple tool, these are probably the 4 best broad areas that cover each of these NEST dimensions. And obviously, if you were building such a framework to look at specific population groups, these would change as well because different things matter to different population groups. You'll also notice on this slide that the positive sense of identity and culture domain is sitting to the right and it sits across all the other NEST dimensions. And so the reason behind this is some research that ARACY is currently doing and will be releasing soon by Lauren Renshaw found that indicators of positive sense of identity and culture sit across all the other NEST dimensions. So they can be measured. However, in the case of this index, if we were to have that as a separate dimension in itself, we would be double counting indicators we'd used elsewhere. So to really accurately reflect and represent positive sense of identity and culture, we would have had to double count indicators. And that would have produced a whole lot of problems because then if children happen to be have a deprivation in relationship with friends, and that was in the loved and safe dimension and in the positive sense of identity and culture dimension, they would automatically be deprived in 2 dimensions. So that would, methodologically, that creates a whole lot of problems. So for this analysis, we haven't looked specifically at the positive sense of identity and culture dimension, but want to acknowledge that by looking at all the others, we're, by proxy, also looking at this dimension. So now that we had sort of a framework to work with to actually measure the nest and measure child deprivation according to the nest, we then needed a data source. And so the most relevant data source for this particular project was the longitudinal study of Australian children. So to give a bit of background on this data source, the study started in 2004, and it surveyed a representative sample of babies who were aged 0 to 1 at the time and kindergartens who were aged 4 to 5. And so the study has surveyed each of these groups every 2 years, and it is still ongoing. The data items in the survey is pretty immense. The list of data items spans about 700 pages, so it's incredibly in-depth and has a wide-ranging, it's a very, very useful source of data. So the particular cohort we decided to look at was the baby cohort, and we looked at them when they were aged 6 to 7 in 2010, 8 to 9 in 2012, and 10 to 11 in 2014. The reason we chose the baby cohort over the kindergarten cohort is that there has been some work done in this space for the older age group, so we thought it would be of more value to look at the baby cohort. Unfortunately, so the Wave 7 data, which was collected in 2016, it has since been released about a month ago. However, it wasn't released at the time that we were conducting this analysis, so we weren't able to include that in our report. So basically we've got our framework, we've got this framework to measure deprivation, we have the data, and now we needed a process to select indicators from the longitudinal study of Australian children to reflect the framework that we've put together. So it was quite a process to do this, and as I already mentioned, the list of data items in LSAC is immense. So firstly, there was a big task of mapping all the data items in LSAC and how they relate to each of the nest dimensions. And that's why it was really useful to do that sort of exercise of developing a framework first, because then you have something to work from. Because as I just said, almost every data item in LSAC can be somewhat related to the nest. So after doing that, we then condensed down the list of indicators by ensuring that all indicators we used to reflect deprivation must be asked of all children or parents in the sample. So for example, some questions would only be asked to a subset of the sample. For example, if a child had moved school recently, then they would be asked specific questions about their circumstances around moving school. And particularly some questions could only be asked of children who had 2 parents living in their home. So those questions were automatically excluded. And then thirdly, because we wanted this deprivation index to be very child-centric, we prioritised data items responded to by children over parent responses. So sometimes parents were asked different questions to children, or sometimes they were asked the same questions, and obviously there's going to be varying responses. However, we thought it was important to really prioritise the voice of the children. And just to note there that while LSAC does also ask questions of teachers, we decided not to look at the teacher questions at all because there's a very low response rate from the teachers. So after having a framework, having some data, and then having a process to select indicators, we basically then, to determine deprivation for each indicator that we selected, we needed to develop a cutoff point. So a cutoff point to say, okay, if a child responds like this, they would be flagged as deprived, and if they responded like another way, they would be flagged as not deprived. So there were sort of a 3-step process, I suppose, to do this. So firstly, if literature indicated a sensible cutoff point to use, that was what we went with. So that's a lot what we use for what's called the Strengths and Difficulties questionnaire, which has, for example, a peer problem scale and an emotional problem scale. So there's been a lot of research using that scale already. So we were able to draw on the literature to develop the cutoff point for that one, for those indicators. If there was no available information in the literature, which was for most of the indicators we used, If it was a frequency question, so asking children how often are you bullied, or how frequently do you experience yelling in the home, then we went with a regularity of that construct or behaviour. So for bullying, for example, it was if children are bullied at least once a week, or for yelling in the home, it was if children responded that they often or always experience yelling at the home. And then finally, we also use scales for a number of indicators. So these are so scales will ask children a series of questions to get information on the construct. So, for example, for school satisfaction, we use the school liking and avoidance scale, which asks children whether they enjoy going to school, whether they like their teachers, whether they enjoy doing maths and English. And so, how we calculated a cutoff point for this was that firstly we calculated a mean of responses for each child. So, for example, a scale might have a possible response format of always, sometimes, or never. So then 1 would be always, 2 would be sometimes, and 3 would be never. So say there are a series of 5 questions in that scale, we would average that out, and the cutoff point, if there's none noted in the literature, would be the midpoint. So if children on average responded that they more than sometimes, basically in this example, experience that behaviour or do that thing, then they would be classed as deprived. We also had to account for missing data a bit. I won't talk about that too much, but I can certainly address that in the questions, Q&A if there are any questions on that. So to sort of summarise, I guess, what we did. So this is a list of all the indicators we used at each wave. So the exact sort of framing and phrasing of the indicators I haven't put in this slide because it varies for each wave. So it would take up probably about 3 slides, but you can look at that in the full technical report. But what this slide shows is sort of each indicator broadly summarised, and shows at each wave who responded to that particular item. So you can see that at wave 4 of LSAC, when children were aged 6 to 7, parents were responding to a majority of the questions, which is not so surprising. But as they get older, children are responding to more and more questions. The colour coding there is, so green means that the indicator was asked consistently over the wave. So for example, with relationship with friends, at wave 4 and wave 5, the parent responded to both questions and it was exactly the same question. So which means that you can sort of compare those answers, the rate of responses for those questions over time. For the orange, it means that the question was asked inconsistently. There were situations, for example, enjoyment of exercise, where for wave 4 and wave 5, the parent was asked the same question at both of those waves. But then at wave 6, when the kids were aged 10 to 11, the same question was asked, but they were the ones responding. You'll also see that there's quite a few not applicables, and that's just the case where there wasn't any data available. What's most notable for that is in the participating dimension. So we were only able to report on one indicator for the whole 3 waves, so that was regular participation in extracurricular activities. And having a say in family decisions, children were asked that at wave 10 to 11. So before going on to the findings, just to talk about how sort of deprivation was generally identified in the report. So what we took is a union approach to identifying deprivation, which is what's encouraged by the UNICEF MODA methodology. And basically what this says, if a child is deprived in any indicator, that automatically means that they're deprived in that dimension. So if a child is deprived in relationship with friends, they're automatically deprived in loved and safe. It doesn't matter how many indicators they're deprived in. So if they were deprived in relationships with family and safe at home, it would show up the same flag. So it does give a really good illustration of prevalence, but this in itself doesn't give a good indication of depth of deprivation. But we're able to sort of produce some additional measures to do that. So we also develop a measure of multidimensional deprivation. So that's children being deprived in 3 or more nest dimensions. So for example, if they were deprived in loved and safe and healthy and learning, then they would be flagged as multidimensionally deprived. And finally, deep deprivation. So if children are deprived in 2 or more indicators within a dimension, so for example, if they were deprived as flagged in financially secure household and adequate food and water, then they would be flagged as deeply deprived in that dimension. So what I mentioned before about the union approach not being able to look at the depth, this is how we've sort of overcome that. And the same goes for this example as well. So just to briefly talk about why we did this, I mean, it would probably have made sense to talk about this before the methodology, but I wanted everyone to get a good idea of what we actually did and then talk about why we did it. And what I really just like is this quote from Vanderveer and McPhee. So the purpose of child wellbeing indices is to distill large amounts of data on children in ways that can be easily communicated to and used by policymakers and the public. So with ARACY talking about the nest and using the nest, we do really encourage looking at all aspects of wellbeing. And this is a tool that can be used to do that. Moreover, Australia has a commitment through ratification of the Children's Convention to collect and disaggregate reliable nationally representative data on children. And also, as part of the Sustainable Development Goals, Australia has a commitment to reduce at least by half the proportion of men, women and children of all ages living in poverty in all of its dimensions. And so to do that, we also need a measurement tool to actually measure those different dimensions. They call it poverty, so multidimensional poverty, which can also be linked to deprivation in this case. So to the key findings. So what this lists is the deprivation rate for each indicator at each wave. And the colour coding here, so for the ones that are in red, so that's a deprivation rate of greater than 15%. For the orange, it's a deprivation rate of 5 to 15, and for the green ones, it's up to 5. So what you can see here is there are some clear indicators that stand out as potential issues. So the frequent bullying or social exclusion is significantly high at all waves. It hits up to 28% when children are aged 8 to 9. Financial security of family stays relatively constant over time and is at around 20% at each wave. Also nutrition as well. So there's quite a bit of fluctuation there. So when the kids were aged 6 to 7, it was around 20, and 8 to 9 it was 18, and it suddenly jumps up to 26%. So what might have caused, well, the reason potentially behind that big uptick is that children were asked the question at wave 6, whereas the parents were asked in wave 4 and 5. So potentially children could be reporting very differently to what their parents were, but it still illustrates that it's at quite high levels at each wave. There are also some good outcomes here that we can see. So what to me was a really good result is relationship with parents, which is relatively low at each wave, which shows that parents are connecting well with their kids, and parents are a real important factor in giving kids better opportunities, and also the participation in cultural activities, again, which the deprivation rate is quite low at about 3 to 4% at each wave, which means that children are getting out in the community, and they are learning out in their community. So just some takeaway messages there, which is what I've just sort of gone through. So by using the MODA methodology, we can then look at the deprivation rate by nest dimension and wave through aggregating them up. So this slide shows a graph, so you can see that the blue bars reflect wave 4 when the children were aged 6 to 7, green when they were aged 8 to 9 in wave 5, and purple when they were 10 to 11 in wave 6. So we can see that Loved and Safe has one of the highest deprivation rates at each wave, and that's largely driven through bullying and social exclusion, and that's also why it sort of ticks up at age 8 to 9, because that's also the peak of when children were experiencing that. Material basics is relatively constant over time. Healthy sort of is also one of the highest and ticks up again at age 8 to 9, and that's largely driven, it ticks up again at 10 to 11, and that's largely through what I just mentioned, the sudden increase in deprivation in nutrition and getting fruit and vegetables. We can see that at an aggregate level, learning improves over time, so the deprivation rate decreases, and that's largely driven through school satisfaction. So school satisfaction tends to improve over time as children get older. And finally, the last dimension, participating, is one of the lowest. However, this is largely a factor of there being fewer indicators to reflect this dimension. So obviously, because we've gone with the union approach, if a dimension has 4 indicators reflecting it, automatically, children are more likely to be deprived in that dimension with 4 indicators. Whereas for participating, there were 2 ways for which there was only 1 indicator reflecting that. So that's why the deprivation rates for that particular dimension are a lot lower, and that is a flaw in the methodology, but something we've had to work with the data we have. But it would be great if we did have more data on participating, we're able to measure that more effectively. So then to go on to the experience of multidimensional deprivation. So as I mentioned before, that is if children are deprived in 3 or more nest dimensions. So what this graph shows is the distribution of number of deprived dimensions children have. So for example, the blue bar is the percentage who have none, green shows 1 deprived dimension, purple shows 2 deprived dimensions, and so on. What I found really interesting about this result is that the distributions are pretty much exactly the same as children got older. At every wave, it's pretty much the same. So in a way, it does sort of give some level of robustness to the methodology, that because this is sort of being measured consistently over time, we're getting kind of similar results at a high aggregate level. But we can see here that at each wave, around 1 in 4 children, we can say have high well-being in every single indicator that we used in the study. So they are not deprived in anything that we've measured, which I think is a good result. However, we also have this group here that I've circled. So that's the 20% odd in each wave that we would be considered to be multidimensionally deprived. So they have 3 or more deprivations, 3 or more deprivations in the nest dimensions. What should be said, though, I don't have this analysis on the slides, is though we did, in the full report, we did a bit of further analysis into the situation of children who are multidimensionally deprived. And they tend to only be deprived in 3 indicators. That's sort of the most common, and that's the minimum number of indicators they could be deprived in to be considered to be multidimensionally deprived. So basically what that says is these children are not severely deprived in anything. They've just sort of got a few deprivations that cover the nest framework. So some takeaway messages there that I've briefly discussed. So then to talk about the experience of deep deprivation. So this is if children are deprived in 2 or more indicators within 1 nest dimension. And as we can see from this slide, up to 25% roughly of children experience at least one deep deprivation. So this was lower at actually 14% when children were aged 6 to 7. And the sort of the increase, I suppose, in deep deprivation when kids got older at age 8 to 9 and 10 to 11 was largely caused by a high correlation between relationship with friends and frequent bullying and social exclusion. So that shows just how related sort of these 2 areas, having good friends, having good connections with friends, and being bullied, are highly related. So those sort of 2 things need to go together when developing policies and programs to address this issue. However, what is positive and what can be seen in this graph is that the majority of children who did have a deep deprivation had only 1. So that's where we look at the green bars. So that was 12% at ages 6 to 7 had 1 deep deprivation, and only 2% had 2. So these children who do have sort of a deep deprivation like according to the nest framework, they do have other resources to draw on through the other nest dimensions that could help them overcome the issues that they're experiencing. And then this slide just goes a little bit further and looks at deep deprivation rate by nest dimension and wave. So for example, that just looks, so for loved and safe, the blue bar is age 6 to 7, the green is age 8 to 9, and the purple is age 10 to 11. And as you can see, so the large decrease in deep deprivation between wave 4 and wave 5 from 85% to 76% is largely caused by that big increase that we've seen from 5% to 14% in loved and safe. So now to go on to some further analysis we conducted. So we looked at 3 particular population groups, and I think this is where the index we've developed is most useful because of the immense amount of information LSAC has, we can tease down into particular population groups. Obviously that depends on the sample sizes of these groups, but it does provide a useful opportunity to look at outcomes of particular children. So firstly, looking at how children with disability fare according to the deprivation index. So I just spent a bit of time talking about sort of the colour coding and framing of these tables. So we have all the indicators listed on the left, and then for each wave, we have an illustration of whether children with disability were significantly more likely to be deprived when compared to children without disability. So the colour coding is either green, orange or red. So green would illustrate that children with disability are less likely to be deprived in that indicator, so they're actually doing better than children without disability. Orange reflects that there's no significant difference, and red would reflect that children with disability are significantly more likely to be deprived when compared with children without disability. The stars in the graph reflect the significance level. So 3 stars means it's significantly different at the 1% level, 2 stars means it's significantly different at the 5% level, and 1 star it means it's significantly different at the 10% level. So that basically gives an illustration of how certain we are that these 2 groups are truly different from each other. And the colour, the transparency of the colour also illustrates, that just aligns with the star level. So I should note, so the disability indicator in LSAC asks children or asks parents whether the child has had an illness or a serious illness or a disability lasting 6 months or longer. So obviously disability definitions do vary based on the data source, so that's what we've used for LSAC. So as we can see here, so basically where children with disability are struggling more than their peers tend to be things where their parents and their families have less control over. So for example, their relationship with friends tend to be suffering a lot more by the time they're age 8 to 9 and 10 to 11. They're experiencing more bullying and social exclusion at school. The financial security of their family is suffering, possibly because parents have to spend more time looking after their children at home and aren't able to get into the workforce. Whereas, children are doing well generally in enjoyment of exercise, they're enjoying being out, they're getting adequate fruit and vegetables. However, again, their mental health is suffering when they hit later years. Their school attendance tends to be worse at all the waves. So it does show that as I said before, in the home environment, children have good relationships with their parents, they're doing pretty well, but as soon as they get out in the community, get out in the school, that's where they tend to experience greater number of deprivations. I should also note, so this analysis isn't in the slides, but we also looked at the prevalence of multidimensional deprivation and deep deprivation. And so children with disability were significantly more likely to be multidimensionally deprived at every wave at all time points. And they were significantly more likely to experience a deep deprivation when they were age 8 to 9 and 10 to 11. And now to go on to children in monetary poverty. So what you can see here is a lot of red, which is quite concerning. And it just shows, so we would of course expect to see that children are significantly more deprived in all areas of their material basics, because obviously that's directly related to income and monetary values. However, the deprivation does spread a lot wider than that in all elements of their health, in their learning, in their participating. One, I suppose, positive thing that can be viewed from this is that in loved and safe, they tend to be doing pretty well and very similar to their peers. So they're not more likely to experience frequent bullying or social exclusion at school, and they have really good relationships with their parents as well. However, they are struggling with their friends, and at wave 6 they are experiencing frequent yelling at home, and that's possibly due to the stress that being in poverty may bring. And finally, to children in jobless families. And of the 3 groups we examined, children in jobless families experienced deprivations in more areas compared to any of the other groups. And so this analysis isn't in the slides, but if you look to the full report, we did some additional analysis that controlled for the income levels they had, because obviously children in jobless families are likely to be of lower income by proxy. However, even when controlling for that fact, children living in jobless families are significantly more likely to have struggles in a range of areas that can't be accounted for by their lower income. So this is relationship with friends, it's bullying and social exclusion, it's homelessness, and it's also mental health. And while we didn't look into this issue in detail, we suspect it's likely due to the stigma that surrounds jobless families and the stress of being unemployed that exists within the families, and obviously it spreads to the children as well. So finally, we've discovered all these issues and through the analysis and through the report, and so we thought it was important to sort of develop solutions that won't necessarily solve all the problems that we've found, but at least will be a step towards helping improve the outcomes of children and young people. And so our first one is a fair go for all kids. So that's increasing assistance to low-income families. That could be reform in any way or shape or form. However, given the issues that were found that children in jobless families face, we do think increasing New Start would go a long way to helping these children and improving their outcomes in all their areas of wellbeing. Secondly, to address the poor rates of nutrition. And I mean, the deprivation rates that we found were staggering in themselves, but even when looking, so other research looks at the actual serving sizes that children have of fruits and vegetables and whether they meet acceptable standards. And the percentage of children not reaching them is staggeringly high, much higher than the results that we found, because we were only able to look at whether they had eaten them at all. So one policy solution for this, which the Obesity Policy Coalition has been putting out, is that to introduce regulation to reduce the amount of unhealthy food marketing reaching children. So on researching this issue, I was pretty astounded to find that this is self-regulated. It's self-regulated by the food industry groups. And so to actually address this, we do need to have sort of some proper regulation for it. And there have been evaluations of how the self-regulation has been effective, and the conclusion is that it hasn't been effective at all. Thirdly, to address the high rates of bullying, we propose to introduce evidence-based anti-bullying programs in all Australian schools. These programs do exist. They've been shown to improve the outcomes. The Peace Pack is one. Donna Cross has also done a lot of work in this space, and they've conducted a number of evaluations of their programs that actually don't address bullying directly, but address the culture in the school and how children relate to one each other, which is found to indirectly impact bullying rates. And that also goes back to what I said before about the correlation between relationship with friends and bullying and social exclusion being very high. So addressing the culture and encouraging better relationships with friends will then, by proxy, improve the bullying and reduce the bullying and social exclusion. Fourthly, so healthy minds. So we found in this report that poor mental health is starting as young as 6 to 7, with around 10% of children experiencing some sort of social emotional distress. So we propose to prioritise preventative and early intervention programs to improve the mental health of Australia's infants and children, because it is starting very young in life. And Emerging Minds are doing some really great work in this space, and the government is supporting that. However, we are advocating sort of for greater investment in this area. The fifth recommendation is to widen the school gates. So this addresses our finding that children with disability are socially excluded in their community and their school environment. So one way to address this is to encourage is to get more inclusive education, get more kids with disabilities into mainstream schools, because the research has shown that this actually has a positive impact on children with disability as well as the children that they're going to school with. And finally, get to know our kids better. So start collecting better data on our children to guide better policy. So currently we don't have any official national collection of children's data in Australia. We've used the longitudinal study of Australian children, which can be used for this. It would be more robust if we had a repeated cross-sectional collection of children, so we could actually measure how things have changed over time, because with LSAC, the children are getting older and older at each time. And so we can't actually look at the static age ranges and see whether things are improving. We also recommend introducing a new birth cohort study. So the children in LSAC and also the longitudinal study of Indigenous children, LSIC, they're growing up. So they're around, I think, 15, 16, 18, 19 at the moment. And research says that a new birth cohort study should be implemented every 12 to 15 years, and we're about at that point. And so such a new birth cohort study should, again, use a very similar methodology to what LSAC has, but also ensure adequate representation of groups that tend to be underrepresented in such surveys, such as Aboriginal and Torres Strait Islander children. So we're going to a Q&A now, so I'll hand back to Paul, who thinks he's going to ask a few questions.
Thanks very much, Kate, for that very insightful deep dive into that report.
Thanks, Paul.
I've got a couple of questions to kick off with as more questions roll in. But the first one is, I guess, just you've been through this report. What was the most startling or surprising finding for you as a researcher?
Yeah, so I guess having done the report card last year at a national level, I was pretty aware of the issues. So, for example, bullying we showed in the report card was quite high, for example. So for me, the most interesting finding was sort of looking into the three population groups. And while I expected to see some areas where, for example, children with disability, children in monetary poverty, and children in jobless families would have more struggles with, I didn't expect it to maybe be quite so widespread as it ended up being. So that was, for me, quite a startling finding.
Okay. Thank you very much. Another question that's just come in. The report shows that a quarter of Australian children are thriving in all dimensions, if we've understood that correctly. Have you got any idea how we compare internationally? Is there anything, maybe this goes back to your earlier work in the report card, but have you got any sense of how we compare?
Yeah, I mean, it's hard to, because, for one, the way we've developed this particular work is very much based on the Australian context. So we've defined deprivation according to what children in Australia think is important. So we can't directly compare these results to any other country. However, interestingly, so MODA, they sort of have two different methodologies. So one is the national MODA, which we've used, which adapts to whatever country context or whatever particular context you want to look at. They also do a cross-country MODA, which you can basically means that you have to have consistent dimensions and consistent indicators and look at how they compare across different countries. So you can certainly look at that. Australia hasn't been compared in those studies simply because we don't have the data available. So they've used data sources that are consistently collected across different countries. But they also tend to be developing countries that they've looked at, so not necessarily relatable, I suppose, to the Australian context. But it would be great if Australia could be included in those collections that are consistently collected across different countries, so we could actually compare our situation to different countries.
Thanks again, Kate. We've got a question in, why wasn't LSIC data used? I think LSIC is the Indigenous.
Yeah, the longitudinal study of Indigenous children. So for this particular study, we wanted to look at wellbeing at a broad level and to look at the circumstances of all Australian children, which is why we use the LSAC data. What's more, we don't necessarily know if the nest is applicable to Aboriginal and Torres Strait Islander children, and I think that would be a whole nother work in itself in finding out specifically to Aboriginal and Torres Strait Islander children what is important to them, and then using LSIC to measure that. We would have loved to compare the outcomes of Aboriginal and Torres Strait Islander children to non-Indigenous children. However, just the sample methodology of LSAC doesn't lend itself to that. So unfortunately, we weren't able to look at that particular group in this report.
Dearth of data.
Yeah.
All right, Kate, I think you touched on this, but the selection of indicators and how you married those to the nest to tease it down to a list of 20 possible indicators. Can you give us a bit more insight around that?
So yeah, as I mentioned, it was a bit of a task to do that. So going back to the nest consultation document and looking at with a sort of a fine tooth and seeing what the children actually said. It was hard to exclude things. So for example, things like health insurance is obviously very important to have and would have fit very well in material basics, but it did have to sort of make those judgment calls about what was highlighted, I guess, in more detail and what at a broad level should be reflected in the nest dimensions. However, to, I suppose, reduce researcher bias in this case, we did put together a group of about 10 experts in the field who are very well aware and of the LSAC data to actually help with that process to make sure reduce the subjectivity of that.
Thanks, Kate. Another one has come in. The policy recommendations you've come up with, and again, I think you've touched on this, but can you perhaps give us a bit more background about how you arrived at those policy recommendations? There's 6 of them. What's driving them?
Yeah.
What are they built on? And how have they been come up with?
Yeah, so there were large, the issues that we identified in the report came directly from the data. And then we sort of took a step back from that and said, okay, what does the evidence show that increases the well-being of children and young people? Once doing that and looking at the literature, we also contacted a number of experts in these areas to help us formulate these policy recommendations. So, for example, the Obesity Policy Coalition helped us put together the policy recommendation for nutrition, Emerging Minds with mental health, Donna Cross and Philip Slee for bullying, David Roy for inclusive education. So sort of having that view of looking at the literature and then talking to experts who are obviously well aware of that particular field to develop these policy recommendations was really important.
This report's much more focused on Australian data. The earlier report you did was much more comparing Australia with international data. Can you talk about the place of the two sort of different styles of reports and the varying uses of each? I know some people are finding this a much easier report to digest than the report card, but I suspect they both have their uses. Can you talk to that a bit?
Yeah, well, I suppose the report card is kind of, I would call it a data dump. So what data is out there on the well-being of children and young people and put it in one report, which I think is really useful because as I know, because I sifted through all the reports and data to put that together, it's everywhere. And having it in one place, I mean, even for one single data source, which reports on one single indicator, maybe over 3 time points, you'd have to, for example, go to 3 different ABS publications to actually get that information. So having the trends there and all the indicators in one place is incredibly useful. Also the international comparators, like you mentioned, all in about 10 to 20 different reports, OECD reports, UNICEF reports. So having, again, them all in one place helps you build, I guess, a better picture of that. In saying that, having to use, I guess, so many different data sources to come to that conclusion means that I suppose the narrative is not particularly well targeted, and that you can't draw simple conclusions because all it does is raise a lot of issues. Whereas using one data source and developing a deprivation index like we have for this project means that it's easier to understand the full picture because it's using the same data, it's using the same children. We can look at population groups. We can easily compare more easily compare the different indicators, which allows us more easily to come to solutions like the policy recommendations we've put forward.
So in short, Kate, I think that there's uses for both reports. There's a mountain of information out there. To get impact on the ground, you need to change political debate. You need to change the minds of policy makers, and both these reports have a role in bringing that data to sort of a pointy end with which to prod politicians and others in the policy
definitely.
space.
And also, as I mentioned in the presentation, I mean, we have a right under the Sustainable Development Goals to actually report on poverty in all its forms. And the report card, which reports on single indicators, doesn't do that.
Thanks, Kate. There's another question in. What do you see as being the limitations to identifying child wellbeing, or lack thereof, as based on the voice of children?
Yeah, I mean, I think it's incredibly important, and an example that they've given in that question is a child might be being bullied or socially excluded, but they don't actually identify it that way. And so because LSAC, for that particular question, asks the children directly, if they don't see it as being bullied, then they may, you know, they don't experience that feeling of being bullied, and they may not necessarily be deprived in that area. However, on the converse, obviously that subjectivity also brings about a number of difficulties. So I mean, I suppose a judgment has to be made as to whether, and you could potentially argue that maybe in some indicators the parents' response is possibly more accurate. I'm not sure that there's any research that's been done to suggest that. However, I think the way the deprivation index is framed and the way the ARACY's NEST framework works is that the voice of the children is most important, and that's why we've decided to go with that.
Okay, I think we've got time for one more question, and in fact I'm going to combine two that have come in because I think they're related. Because I think one kind of answers the other. The first part is, why is it so hard to get better, good data on children, which I think you touched on in the recommendation, and I think that question feeds into the next question. I'll get you to answer them as one. Are there any plans for a similar report for the next year or the next 3 years so that movement can be tracked, and what might be the challenges around putting a report like that together?
Yeah. So to answer the first question, I don't think it's all that hard to get data from children and young people. We just don't have, it's not a priority at the moment. So we do, you know, the ABS collects a wealth of information from adults on their social circumstances, on their well-being. But we don't ask that of children, and I think that's partly because the funding isn't there, but also partly I don't think we value the voices of children enough to actually go ahead and do that. Obviously, it would involve a lot more resourcing to ask questions to survey children compared to adults with ethical concerns and all that sort of thing. But if we considered it, if Australia, you know, in the community and the government, if we considered it to be a priority, we can and we would be doing it. Other countries are doing it all over the world. And you know, as I said, we do that with LSAC, and there are a number of smaller studies as well. For example, the Australian Child Wellbeing Project, who have gone out and have surveyed children and have found really interesting conclusions. However, what's really important is to get that nationally consistent collection of data that abides by official national statistics standards that only the ABS, only the government can do. So I would say to that question, it's not particularly hard. We're just not doing it. To go to the second question, whether there are plans for a similar report, definitely possible. So with LSAC, I mean, a new wave has just been released. So we could look at the circumstances of children as they've gone. So there were 10 and 11 in the last wave we looked at. There'll now be 12 to 13. So it'll be really interesting to see how that has changed. Obviously, we'd need to be measuring deprivation in a different way. But it would be interesting to see, especially given, you know, it was collected in 2016, so it'd be much more recent data. Also, we could do the same analysis for the kindergarten cohort as well. So those kids would be aged around 18 to 19 now. So to look at their circumstances would be really interesting. And I mean, what we haven't done in this report, which I would love to do, is look at the longitudinal outcomes of children. So while we've used a longitudinal data source, we've used it kind of cross-sectionally. We haven't looked at linkages over time. We've looked at sort of a cross-section of kids aged 6 to 7, a cross-section of kids aged 8 to 9, and a cross-section aged 10 to 11. What we could do with this report is look at what were children's circumstances when they were 5 to 6, and how does that impact their situation when they're 10 to 11. And given that LSAC, from what I understand, it is going to keep going through the year, so they're going to keep surveying these young people are going to become adults soon, and they're going to continue surveying them, and then they're hopefully going to start surveying their children as well, and so we can start to see these intergenerational impacts as well.
Thank you, Kate. I think what at the nub of this is that getting data from children is not necessarily hard, but getting it listened to is a lot harder, and I think that's partly because children's policy is often not made by children. Yep. Funnily enough, even though the nest included a massive consultation with young people themselves. At the end of the day, it comes down to grown-ups, be it in Parliament or the public service, to develop and implement that policy. And I think that probably creates a natural bias, which is something we all need to work very hard to get over. The fact is that our children may not vote, but they do matter, and that's something we need to really keep pressing home as the election nears. Kate, thank you very much for that very, very insightful look at that report, which is available on the ARACY website free of charge. Just visit our website, look under publications, and you will find it. Please read it, enjoy it, spread it amongst your cohorts. We have a busy schedule of events coming up in the near future. We've got our Fiona Stanley Forum to be held in Melbourne on the 13th of March. Registrations are available for that. Again, please visit our website for more details. Free for members and $50 for non-members. Well worth it. Our Chief Executive, Penny Dakin, will be launching an important policy document at that event, and it will also be attended by Fiona Stanley herself, who will say a few words to us, so that'll be well worth coming along to. We also have, in the lead up to the election, whenever that will be, but we think it's going to be in May, ARACY will be running a number of webinars where we'll hear from various groups in this sector. Basically, we'll be asking them what they want to see coming out of the election campaign and the next government for Australian children. So that'll be a series of webinars coming up starting in mid-March. Please keep an eye on our website for that, and keep an eye on our e-bulletin. We'll be advertising those and letting you know when they're on. We'll wrap it up. Again, thanks to everyone who tuned in. Thank you for your interest. Thank you for your ongoing support of ARACY. Thanks especially to Kate for the presentation, and more importantly, all the work you've put into producing this report, which we hope will keep Australia's children in the centre of the debate as we move towards the next federal election. Until next time, thanks for tuning in.